अच्छा रहता है। तो नेशनल लेवल पे, स्टेट लेवल पे डीटीओस की एक बहुत इंपॉर्टेंट पोजीशन और अच्छी पोजीशन बनती है। मेरे ख्याल से ज्यादातर डीटीओस मेरी इस बात से एग्री करेंगे।
Right, absolutely. And so if there is a single most important indicator for the TB program, it is notification. And we know that it has taken a dive during the pandemic. And now we have to see that it again rises to where it was up in 2019 level and so forth. So before, as we work on the technical glitches, we'll just wait for a few more minutes. And another area that's of interest that people have talked about has been, how are we going to work long-term in eliminating TB? And one of the areas that is of great scientific endeavor has been the latent TB treatment. And what we're seeing in latent TB treatment is that there are new regimens that are coming out. These are regimens that can be very exciting and easy to use. And we've been part of that research with Dr. Neil Gandhi, who's one of the folks at Emory University. And he has been involved in tremendous amount of research, both in the transmission and looking at some of the latent TB work as well. So as we are now getting populated with DTOs coming in, apologies for the first few minutes. We'll take another minute or so, Commodore Raman, as we have our other DTOs joining in.
Absolutely, absolutely. The technical has been resolved.
Perfect. Yep. And just to put things into perspective, I was looking at the global numbers for TB and for India numbers. We know that globally that we have seen that there are 10 million cases of TB that are there, and there are about 1.5 million deaths. Which is a bit more than I would say about, so that's almost 15% globally people die. What's really interesting in India, we have a lot lower percentage of deaths, 2.5 million cases with about 220,000 or so deaths, still significant number of deaths. As we improve, we will see the number of deaths go down significantly, and we will see that the cases also go up. So with that, and as people are joining in, Commodore Raman, let us get started and let us welcome the DTOs and let us begin.
Thank you so much, Dr. Manoj, and DTOs, good evening to you and welcome once again to a great session. Today's session is going to be hugely interesting. One is that is towards the end, we will all go into breakout rooms. So to say, you will go and the last half an hour of the session would be in the counselor's office. And that is where you will get to see how much progress our program has made, how much progress you have made, how much progress your colleagues have made, and what else can we do better. Also, all the DTOs, you'll be very pleased to note that we have populated your district's data, which I will request Dr. Manoj to mention it during the session again. The district's data of notification, and we have plotted it in a graph as a benchmark, as a milestone, as a dream, as a vision for all of us to pursue at a district level and at the national level. I have requested the counselors are ready. They will showcase it with you. They will discuss it with you in the breakout session. So last session, we saw the entire PDSA recapitulation. We saw aim statement, we saw process measures, outcome measures, we saw process maps, we realized what are interventions, and then how the process happens. Well, DTOs, we are not here to teach clinical diagnosis. Nobody can do it better than you, ladies and gentlemen, can do it. But when we look at you as DTOs, I can say from my side that I don't look at you as doctors. I look at you as managers. Managers who are managing teams, managing behavior, managing the environment, managing their seniors, managing your subordinates, managing communication, managing media, managing time, managing priorities, managing family, and managing CETI and this PDSA. So you are great managers. But can you do it alone? If it was just diagnosis, if only your efforts could eliminate TB from this country, I am sure all of you DTOs could have burned the midnight oil and raat din ek karke, throughout day and night, you'd have worked and eliminated TB. But you cannot do it alone. You need your team. You need to have a great team where you can distribute the job. And that is what Dr. Manoj, Dr. Mohan, and Dr. Salil bring to you today in leadership, situational analysis, and delegation. So I will not waste any more time. And there are 6 wonderful DTOs who will join us as guest faculty, whom I would request Dr. Mohan to introduce. So Dr. Mohan, over to you.
So as Dr. Mohan is coming on, yes, glad to be. The discussion today is going to be what are going to be the 3 key skill sets in leadership and management that will make BTN successful. So Dr. Mohan, you're on.
Well, thank you. I just need to cross check again, Manoj, because of this technical glitch. I need to see Dr.
Absolutely.
Manoj. I'm pleased to welcome Dr. Manoj Verma, and I hope he is here, has been able to join. He was having some difficulty as everybody else. He is a district TB officer for Bhopal in Madhya Pradesh and has been working for various different programs including NCDs, HIVs, and has treated more than 1 lakh patients throughout his career directly and indirectly. So he brings in a lot of experience from different factors, and he is currently the nodal person for the lab services model, right? And he has publications along with, he was working with AIIMS Bhopal. So he has publications also which he has related to that. Welcome, Dr. Manoj. And in addition to Dr. Manoj, I would like to also welcome Dr. Major S.B. Prasad from Supal. He's the DTO in Supal, and he's also the ACMO for the district and the nodal for RT-PCR lab at Supal. In his achievements, he has been able to successfully set up the ART center himself, the RT-PCR lab, and the TruNat lab for the COVID. Dr. Major Prasad is also there.
Wonderful.
Good. We were able to actually have a good start. So I would like to, we need to understand that our effort or focus towards for the next 2 months is on boosting TB notification, right? But to do that, we need to be able to, understand the basic principles of leadership and management to get the best out of our team. And we need to understand that although we understand and read things, but in the real world, things work out differently. Challenges are different, Some challenges are very easy to understand and a very simple answer is there. Whereas on the other hand, some challenges which we all seen over the last 2 years, extremely complex, ever changing, mandates us to keep on thinking about it. So I would like to bring in Dr. Verma here and would like to ask him to throw some light on different kinds of challenges and how to identify what we need to do. Sir? Dr. Verma?
Yes, Dr. Verma, welcome. And if you can unmute yourself. Yeah, there you go.
So you have to unmute, sir.
Yeah, go ahead and unmute yourself, Dr. Verma.
Okay, sir, आवाज आ रही है मेरी?
Absolutely.
Yes, आ रही है बिल्कुल. क्या हाल चाल है, Dr. Verma? Long time no talk. Good to see you. Very nice to see you. Yes, yes. Yeah.
As you asked, what are the challenges? So definitely few challenges are there, that is technical and adaptive. Technical challenges, they are comparatively easy to solve. I think we can manage them very technically. When we provide the technical information, these technical challenges can be met with. जैसे many times private practitioner don't know how to notify the patient. It's a somewhat of technical challenge because he may not be know how to log in, how to enter the patient name, where to enter, age, etc. everything. So this can be managed easily. But many times other challenges also come when doctors doesn't know when a healthy patients come, just like healthy 60 kg, 70 kg person comes, some mild cough for 2-3 days, he says. But many times he says he has very long cough,
जी sir.
but not able to prescribe exact duration. He says 5 days cough means I am suffering very much from the 5 days. It is not 5 days
Right, sir.
before it was
Right, sir.
originated.
Got it.
So this concept के doctor doesn't imagine, because our eyes don't see what our mind don't know.
जी.
कभी हमने इमेजिन ही नहीं करा कि इतना हट्टा कट्टा हेल्दी 4 दिन की काफी खांसी वाले पेशेंट को वी कैन with CBNet we can diagnose very
So,
comfortably. These are the adaptive
sir, in
problems.
other words, he needs to change his thinking, right? His
Yes,
behavior.
he has to change thinking, change करना पड़ेगा, थोड़ा सा attitude change करना पड़ेगा, थोड़ा सा जो approach है वो change करना पड़ेगी. But that yes, many times private doctor sends के okay तुम्हें खांसी आ रही है, go and get sputum examination. Negative, go and get examination, sputum.
We have to change our habits and improve
Yes,
from
these
that,
are the
right?
habits which comes up.
Great.
Many times says they refer second patient negative, third patient negative, fourth patient negative, fifth patient negative. He says डॉक्टर साहब कोई फायदा ही नहीं है, आप क्या सभी नेगेटिव आते हैं? So he has to make a concept that in the best ideal condition only 10% positivity is possible.
Good. Thank you,
so
sir.
Please continue, send 10 patient, then ask why not I have not even received a single positive patient.
Great.
So
sir,
yes.
It is like, sir, what we need to say is, sir, we can actually prepare water and get water for somebody, but the person has to drink it. The technical challenge is getting the man to the water or the horse to the water. But to make the horse drink water is the adaptive challenge he needs to think about. Great. Thank you so much, sir. Sir, Dr. Prasad, I would like to bring you in, sir. We understood that there are different kinds of challenges, sir. So if there are different kind of challenges where we need to, change our thinking. So a leader as a DTO to manage notification and so many different kinds of challenges there are, and to get the things done, a different kind of role needs to be done by a DTO. So what are the kind of roles and what is the kind of behavior a DTO needs to do? So can we just throw some light on that?
Yeah. पहले नमस्कार सबों को, जो भी पार्टिसिपेंट हैं और जो ऑर्गेनाइजर हैं, सभी को मेरी ओर से नमस्कार, और आपने जो मौका दिया इसके लिए बहुत बहुत हम धन्यवाद करते हैं। अब जहां तक लीडरशिप की बात है, तो डीटीओ जो है वह लीडर है, वह इसका एक टर्म में कहा जाए तो मास्टरली इनएक्टिविटी। आप माने मास्टर हैं, लेकिन माने आप इनएक्टिविटी केवल मॉनिटर करें, यही होना चाहिए। जो लीडरशिप का यही है। और जो भी हमारी समस्या है, क्या हमारे टास्क दिया गया, उस टास्क जो भी हमको दिया गया उसको बहुत मेटिकुलसली उसका माइक्रो प्लान बनाए हम, और माइक्रो प्लान बनाने के बाद उसको हम फिर उसको अपने जो हमारे टीम के लोग मेंबर हैं उनकी क्या एबिलिटी है, उसके एबिलिटी के अनुसार उसको उस टास्क को सब टास्क हम दें। तो फिर हमारा जैसे कि सबसे जरूरी है मेटिकुलसली, जैसे कि हमने देखा होगा, आपने जो पाकिस्तान में इंडिया सर्जिकल स्ट्राइक किया था, तो उस समय जो वहां पर हम रात में स्ट्राइक करेंगे तो रात में कुत्ता भौंकेगा, तो भौंकेगा तो उसको कैसे, तो हम अगर बाघ के यूरिन को अगर हम स्प्रे कर देंगे तो उसके स्मेल से कुत्ता बार्क नहीं भौंकेगा। तो इस तरह का मैंने मेटिकुलस जैसे आर्मी में किया गया था।
आपने आपका कहने का मतलब सर बिगर पिक्चर देख के टीम को बोलो अब आप काम करो, हम मॉनिटर करेंगे और सपोर्ट करेंगे, है ना सर?
हाँ, और दूसरी बात, जो पहले तो सब टास्क देंगे हम, मेटिकुलसली प्लानिंग करेंगे। दूसरी बात क्या कि हम उसको हर एक जो एबिलिटी के अनुसार उसको सब टास्क देंगे जो तुमको अब यह करना है। अब उसके बाद जो है हम उसको समय समय पर इंकरेज करेंगे। अगर कहीं कोई फॉल्ट आ रहा है तो उस फॉल्ट को हम चाहेंगे कि जो हम अपने अनुभव के आधार पर उस फॉल्ट को रेक्टिफाई करें और उसको इंकरेज करें ताकि वो अपना जाए।
मेंटर करेंगे, सपोर्ट करेंगे और वापस लाइन पे ले आएंगे अगर भटक रहे होंगे तो।
भटक
कहना
रहे
चाह रहे
हैं
हैं सर?
तो हाँ, इसके बाद फिर अगर माने उसको उन लोगों से हम जो हमारा प्लान है, माइक्रो प्लान है, अगर उसमें जो हमारे नीचे के लोग हैं अगर कुछ सजेशन देना चाहेंगे जो उसको माने हम इम्प्रूव कैसे करें, उन लोगों से भी फीडबैक लें। जो हमारा प्रोग्राम है उसका फीडबैक लेंगे और फीडबैक के अनुसार हम फिर उसमें जो उन लोगों, जैसे कि अगर हमारा आशा वर्कर भी है, आंगनबाड़ी है या हमारा एसटीएफ है, उन लोगों का फीडबैक लेंगे और फीडबैक के आधार पर फिर हम उसको अपने अनुसार से कैटर करके फिर हम उसको रेक्टिफाई करके अपने माइक्रो प्लान में चेंज करेंगे और उस तरह से हम काम लेंगे।
थैंक यू सो मच सर। जस्ट टू समराइज, देखिए अभी जो व्हाट वी हैव बीन अंडरस्टैंडिंग ओवर हियर, Manoj, I would like to bring you in here. See, what happens is we don't live in a utopian society area, right? There are challenges keep on changing themselves, right? So what we need to understand is even in a notification, like has been pointed out by Dr. Manoj and Dr. Prasad, even in notification there will be different kinds of challenges. Some will be straightforward, like giving a definition, training, and it is done with, or giving some equipment. Other challenges would be like changing the behavior, getting the people to come to the PHI, right? Only then they will be diagnosed. Once the private practitioner diagnoses a case, he has to make a habit, change his habit to report a case. He is not in the habit of that. And changing habit is uncomfortable, right? So for the team also, when our district team has to move from control mode to elimination mode, they also become uncomfortable, right? And well, like pointed out by Dr. Prasad, they have to look at the bigger picture, the DTO. That's his role. Look at the bigger picture, guide from above. Once you identify the challenge, let the team do the work, right? But
right. So,
Manoj,
so let me add. Let me add.
Yes.
Let me add something just to Dr. Kohli.
Yes.
So what I really heard from Dr. Manoj Verma, a great colleague of mine for many years, is that we have to be looking at our challenges in a couple of unique ways. Now,
Yes.
we're developing what are the skill sets that are going to make our BTN successful. And what I'm hearing also from Dr. Prasad is that we have to be able to be looking at leadership and looking at the importance of leadership. So that's the first skill set. We as DTOs, you as the ones who are in the leadership position have to see and navigate that very role. And what we're saying is the technical role is okay. It is that
straightforward and simple, yes.
It's simple. We can learn that in medical school, but it is that adaptive role. And that is what I'm hearing. And let us hear more about
and
what
these
this
6 points,
adaptive
Manoj, is
is.
what Dr. Prasad pointed out.
Yes,
right?
Let's talk about that. Yes.
You need to get some bird's eye view. You don't always need to be in the problem. You need to work
Sure.
on the problem, not in the problem, right? Looking at from outside, from a bigger picture. So you see where we are missing, how the team is performing. Then
Perfect.
Once you identify the problem, you put it in front of the team and let them work on it, right? Let them work on the change. But remember, Manoj, whenever we want to change something, our habits, it's a difficult thing to do. We get stressed out. So here comes the role of the team leader to regulate the people, maintaining a discipline. I mean, not to let them go here and there haywire, getting them back on track, getting the train back on track, right? And remember the last point, sir, very, very important. The leadership voices can come from anywhere, which means the right answer can come from the bottommost place. So hear everybody out. You never know. It's the grassroots worker who will usually give you the right answer for the grassroots work, right? So this is the important role for a team leader, for a DTO, and they have done this knowingly, unknowingly over the last 2 years. They have been doing it. Right? Thank you so much, sir.
So great.
And,
let me ask if Dr.
Yes.
Manoj Verma and Dr. Prasad, any other thoughts and comments on the first major point that you have made is for BTN to be successful, the DTO must take leadership. Leadership is essential. And that is the very first of the 3 points that we'll be making today. So any further comments from you, Dr. Manoj Verma and Dr. Prasad? So much for your input. Yes, Dr. Prasad, go ahead.
नहीं, अर्लियर मैंने फर्स्ट ही बताया कि जो मास्टरली इनएक्टिविटी, जो डीटीओ का रोल है वो मास्टरली इनएक्टिविटी है। हम माने वहां पर मॉनिटरिंग करेंगे, अपना काम नहीं करना है, हमको मॉनिटर करना है सब चीज को, और प्लानिंग को जो टास्क दिया जा रहा है गवर्नमेंट के द्वारा या जो भी है, तो उसको हम लोग उसको एक प्लान बना के और सबको सब माने जो हमारे मेंबर हैं, टीम के मेंबर हैं, उनको डेलीगेट करना है और उनसे करवाना है। हम अपने केवल मॉनिटरिंग करेंगे और टाइम टू टाइम पर उसको मोरल बूस्टअप करेंगे, जो शाबाशी देंगे, और फिर उन लोगों से फीडबैक लाके उसमें अगर हमारे कुछ प्लानिंग में कुछ शॉर्ट कमिंग्स है तो उसको हम लोग चेंज करके फिर से हम रीइंफोर्स करेंगे अपने जो हमारा टास्क को, टारगेट को प्राप्त लेने के लिए, टारगेट पाने के लिए।
Excellent, excellent.
So Manoj, actually sir has brought us to our next topic, right? By opening this topic, next two topics sir has talked about. One is delegation, which is the third panel, right? But before delegation, we need to do what we have to do, right? And to do that, we now know that what the leader's role is. And one of the important role is to guide the team to do the right thing and understanding our strengths and weaknesses, which brings us to our next topic of today, that is understanding ourselves, our team, our strengths, our situation, what we do good, what we need to do better, right? For this, I would like to call Dr. S.D. Ojha from Sant Kabir Nagar, Uttar Pradesh. He's been the DTO for the last 4 years. However, he has covered almost all the national health programs over his last 25 years of service, and he brings all these best care practices to NTEP. Dr. Ojha, I suppose you are here, you have joined here and not stuck in the waiting room. And in addition to Dr. Ojha, I would like to call Dr. Tenenlo James Kativa, who is the District TB officer from, welcome Dr. Ojha, who is a District TB officer from Mon District at Nagaland. And he is also holding the charge of District Program Officer for various diseases, including communicable, NTB, AIDS, hepatitis, blood safety. So, getting the best from various worlds. And he is also the SMO in charge of a CHC. Welcome, Dr. Kativa. So what I would like to point out over here is, as pointed out previously, a leader does some kinds of tasks, but to get the work done, we have to use the team. We have to use our strengths and weaknesses, and we need to know what we do good as an organization, right? So, hello.
Yeah, you can go ahead. And yeah, you're audible, and you can remove slide share so we can see the panelists better.
Sure.
Yeah.
Good. Thanks.
Superb.
So I would like to bring in Dr. Ojha over here, and would like to ask a simple question, sir. What are the kind of things that you need to do to understand where you lie? What are your strengths? What are your weaknesses? In order to see the bigger picture about our organization, how do we do, and what are the usefulness? Use of these things, sir. Can you throw some light on this so we can understand the same situation? डॉक्टर ओझा।
थैंक यू सर, मैं डॉक्टर ओझा बोल रहा हूँ। जी सर, ये आपने कहा कि हम क्या कर सकते हैं नोटिफिकेशन बढ़ाने के लिए, तो अभी तो हमें देखना होगा कि कैसे हम अपनी टीम को कैसे बूस्टअप किया जाए, हमारी टीम की मोरल को कैसे बढ़ाया जाए। और पहली बात, दूसरी बात जो है हमें देखना, हमें जो है हमारी टीम में क्या कमी है, नोटिफिकेशन के लिए क्या कर सकते हैं। जी, जैसे नोटिफिकेशन में क्या क्या पॉइंट है, पेरिफेरल में क्या पॉइंट है, पीएचआई लेवल में क्या पॉइंट है, आशा आंगनबाड़ी लेवल पे क्या पॉइंट है, ये हमको डिफाइन करना पड़ेगा। और स्पेशली जैसे हमारे डिस्ट्रिक्ट में है, तो हमारी डिस्ट्रिक्ट में पहले हमारा नोटिफिकेशन 62% था, इस समय एट प्रेजेंट नाउ अबाउट 94%। तो इसके पहले मैं मरीज देखता था, मैं एज ए कंसल्टेंट काम भी करता था और डीडीओ काम करता था, तो उस समय मैं बिल्कुल फील्ड में जा नहीं पाता था। फिर अब फ्री हो गया हूँ 3 महीने से, तो नोटिफिकेशन मेरा बढ़ रहा, बढ़ गया मेरा। अगर डीडीओ को ही काम मिलेगा तो चलेगा, अगर डीडीओ पेशेंट देख रहा है लगातार तो मुश्किल हो जा रहा है।
राइट, ग्रेट
सर, आपका कहने का मतलब है हम अपनी करंट सिचुएशन, परिस्थिति, आज के दिन हम कहाँ है, वेयर आर वी स्टैंडिंग टुडे in terms of what are our strengths and weaknesses. You talked about that, what we are doing good, you talked about 94%, but some things are not that good. So our weakness is where we are not doing so good, right? So great. It means we need to know where we are in order to plan for where we are wanting to go, and to understand our inside, our team's weakness and our outside things which help us. Great. So I would like to bring Dr. Kativa here. So, sir, is there a way of doing this? And do what things we need to keep in mind when we are trying to understand our situation? So could you just add some points to that, sir? Dr. James?
Yeah, Dr. Kativa, go ahead.
Okay, it all depends through the participatory approach of involving all the stakeholders like private practitioners, NGOs, faith-based organizations, and in our small area like self-help groups, government, and others to get the complete picture.
Okay, comprehensively.
Yes.
Excellent. So, what I'm hearing here is the following, and let us add to this following process. First of all, we discussed earlier that leadership is important. DTOs take leadership, and we've talked about the different types of leadership. Now what we're saying is, oh, wait a second, leadership is important, but we need to know where our organization is. Jaise Dr. Ahuja ne bola that you have to analyze the situation and do it in a systematic way, right? Know what your strengths are. If you have certain TBHVs who are working really well, know where your weakness is. Maybe the ASHA workers have not worked in a particular area, right? And then look at your opportunity. Maybe you get along really well with the state TB officer. That's your opportunity to be able to expand. Maybe another opportunity is this course. Here's an opportunity where you can come and have a conversation and get your reach. You're reaching over 300, 500 other DTOs, right? And also know your threats. Know that if you're not able to move ahead, that what are some of the reasons that are pushing you back. So that is what I'm hearing.
I would like to also bring in either Dr. James or Dr. Oja to share any experience which they have had, in doing a sort of analysis situation. Recently, we would have a lot of opportunity. Would you want to share any experience about doing a situation analysis?
इस सिचुएशन एनालिसिस में सर जो सबसे महत्वपूर्ण बात इस समय है कि प्राइवेट सेक्टर नोटिफिकेशन को इम्प्रूव करना पड़ेगा, और इसके लिए डिस्ट्रिक्ट के होम्योपैथिक, यूनानी, एलोपैथिक समस्त डॉक्टरों को इन्वॉल्व होना पड़ेगा। होम्योपैथी हो चाहे यूनानी हो चाहे आयुर्वेदिक हो, सबको इन्वॉल्व करना पड़ेगा, सबकी ट्रेनिंग दी जाएगी। और इसके क्रम में हमने अभी जब से ट्रेनिंग शुरू की गई है, हमने जिले के समस्त आयुर्वेदिक और एलोपैथिक डॉक्टरों की ट्रेनिंग करवा दी है, और एमओआईसी और एमओटीसी ट्रेनिंग करवा दी है। इस समय हम लोग डेली पर डे जो है एक टीयू पर जाकर के सीएचओ की सैनिटाइज कर रहे हैं हम लोग आज।
Great. Thank you, sir. And Dr. James, would you want to add an example of where you did an situation analysis?
Yes. During the COVID and subsequent lockdown, this has impacted our notification rate.
Okay.
And even after the easing of lockdown and notification was not picking up, especially for our district. So I made an analysis whether what is going wrong, because even after easing the lockdown, notification was not picking up.
Okay.
So I made an analysis and came to the conclusion that people were apprehensive to be diagnosed with COVID and been isolated or quarantined. So we did a very extensive IEC activities, advocation, this ACSM activities in different platforms like NGOs, platform village, functionaries, faith-based organizations, like in temples, churches, and mosques. We send our workers, as well as I went with them also sometimes, when the time permits. And after this activity, we did culminating to the World TB Day.
Okay.
And
great.
in the month of March, our notification picked up by 51%.
Wow.
Our monthly target was 48, and we could achieve 89.
Great. So this shows that once you consider the comprehensive situation, analyze from all aspects, you get to know where you can actually hit to make the best impact.
Right.
That is what a situation analysis helps you to do, and it saves you resources.
Perfect.
Right.
Yes. And these two are excellent examples. We also have a question from Dr. Kamareddy. As we're going to some of our slides, I think if Dr. Kamareddy would like to either put it in chat or you can ask a question as well.
He's DTO Kamareddy, Dr. Idris.
Okay, Dr. Idris, excuse me.
Yeah, Dr. Idris, yeah.
Okay. By the time the question comes, let me just to summarize what situation analysis is to understand where we are, right? So that we can plan where we want to go. And it will actually answer many of the questions we are currently asking for notification, right? And we keep on asking this. But to get the right answer, we need to do a proper situation analysis, because we can do one of four things. One is follow what the CTD says, do the routine thing, right? The other option is do what your peers are doing nearby, or try something new. But how do we identify, Manoj, what we need to do? That will come from a situation analysis, which will give us where we are, what our delivery circumstances are, where we are good, what advantage we have over the others. We also need to understand why patients are going to the private sector. What are their strengths? What are they giving? Right? Because that can impact how we are performing. What the political situation is, economic situation is, and current pandemic situation is. Once we know those things, and we need to know what the customer demands. A customer at this point of time is the patient. So once we know that, we will be able to form a proper plan to move forward. Right, Manoj?
Excellent. And this is really important. What we hear from Dr. Katiwa was the following, that he did a situation analysis. And so for us to improve notification, right? Number one, take leadership. You are taking leadership. Number two, do a situation analysis. Look at what are going to be some of the things that are your opportunities and what are your threats. Move ahead on your strengths. And you may not have to do it all formally, but internally take a minute and reflect. I think these are some of the key skill sets that makes us all very successful. Yes, I believe we have a couple of questions. Commodore Raman, we can have those questions. We have some time for a conversation.
Sure.
I think Dr. Idris, you called. I think he could not hear. I think we'll go ahead with the session. And if there are questions alongside, we'll take them on.
We will have 5 minutes after the session for the
Perfect.
Manoj,
and
I welcome Dr. Salil is here, right?
Oh, yeah, right.
Yes, please.
Manoj, what I'm looking that you are trying to behave us as a good businessman who makes a business very successful, and certainly we should behave like a corporate also. That's absolutely right. मैं क्या देख रहा हूँ, आप लोग ये हमको सिखा रहे हैं कि we should think out of the box thinking होना चाहिए, नई चीज होना चाहिए, कोई नया innovation, क्योंकि जो बाकी चीजें हैं वो हम सब लोग लगातार कर रहे हैं, उसके बाद भी यदि नोटिफिकेशन नहीं बढ़ रहा तो कहाँ पर प्रॉब्लम आ रही है? Where is the hurdle? Where is the problem? लोगों को दिमाग में, डॉक्टर्स के दिमाग में, मन में क्या डर है? As one of the DTOs rightly said, कि उनको निक्षय को यूज करने में प्रॉब्लम हो रही है. हमको हमारे किसी एक आदमी को भेज के उनको निक्षय को यूज करना सिखाना पड़ेगा, या एक वीडियो बना के शेयर करना पड़ेगा हाउ टू यूज निक्षय. आप अपनी लोकल लैंग्वेज में एक वीडियो यूट्यूब पे बना के या कैसे भी शेयर कर सकते हैं. अपनी टीम को एक्सपेंड करना पड़ेगा. हमको हमारे साथ जितने एनजीओ जुड़े हुए हैं, हमारे प्राइवेट डॉक्टर्स हैं, दोज हु आर वेल विशर्स ऑफ द प्रोग्राम, एनीबॉडी. आई हैव सीन इन इंदौर वन ऑफ द डिप्टी कलेक्टर्स, उनको बड़ा इंटरेस्ट था इसमें के नेशनल प्रोग्राम्स में, और वो बात करती थी और उन्होंने हमारी बात सुनी, हमको आइडिया दिए और हमारे साथ प्रोग्राम्स पे ज्वाइन किया. उन्होंने बोल रखा था कि आप जब बुलाएंगे मैं आऊंगी. सो ट्राई टू फाइंड आउट who are your friends, आपके दोस्त लोग कौन हैं, प्लीज आइडेंटिफाई देम। इसमें प्रोग्राम में दुश्मन कोई नहीं होता, कुछ लोग आपको हेल्प करना चाहते हैं, उनको बुलाइए, उनको पकड़िए, उनको साथ लेके चलिए। आप अकेले नहीं दिखे, आपके साथ पूरा एक बड़ा ग्रुप दिखे जो कि आपके जिले से टीबी को खत्म करना चाहता है। और उसमें नोटिफिकेशन तो एक इंपॉर्टेंट चीज है, डीबीटी और डायग्नोस्टिक एक्टिविटीज, कैंप की एक्टिविटीज, ये सारी चीज हम सब मिलके कर सकते हैं। Over to
Perfect.
yeah,
That is, sir, that is scanning your environment where
Yes.
you can use what you can use, right?
बिल्कुल।
Right. And our DTOs are doing it, sir. To be very fair, most of them are working on CSR work and all those things. That's a good thing which we have started doing.
Right.
So, but sir, can the DTO do everything alone? I don't
मेरे
think so.
ख्याल से नहीं 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 नहीं। क्या होता है डीटीओस के पास अभी, अब तो मैं तो ये देख रहा हूँ कि इट्स नॉट ओनली टीबी प्रोग्राम, दे आर वर्किंग फॉर एचआईवी आल्सो, दे आर वर्किंग फॉर फ्यू मोर प्रोग्राम्स। एज आई वाज लुकिंग एट वन ऑफ द डीटीओस वर वर्किंग फॉर एनसीडीज आल्सो। तो इतने सारे काम हैं उनको, सो दे नीड टू बिल्ड अप ए बिग टीम, they need to assign or delegate their duties to their friends whom they can believe or who can support them. तो उन लोगों को साथ लेके चलेंगे। मेडिकल ऑफिसर हो सकते हैं, कोई एनजीओ के पार्ट हो सकते हैं हमारे, जो कुछ लोग हमारे साथ काम करते हैं जैसा मैंने बोला, या हमारी टीम में से ही टीबी एचवी लैब टेक्नीशियंस, उनको हम थोड़ा सा प्रमोट करके और उनके काम के अलावा भी उनको ड्यूटीज डेलीगेट कर सकते हैं। एंड हाउ वी शुड डेलीगेट देम, आई थिंक यू आर गोइंग टू टेल ऑल ऑफ अस दैट हाउ एंड व्हेन एंड whom we should delegate.
Great, sir. So, well, जैसे इनिशियली मेजर साहब ने बोला था, मेजर प्रसाद ने डेलीगेशन पे बहुत स्पेसिफाई किया था और फोकस किया था। नाउ वी कम टू डेलीगेशन। सर, you said it rightly. I cannot do everything myself. I need to involve my team. But how I need to do it? So let me welcome Dr. Ved Prakash, who is the district TB officer at Churu, Rajasthan. He is also looking after CHC Dotsar and has been awarded for Kayakal program for quality improvement in the hospital. That's a cleanliness and overall quality improvement, and for TB boosting TB notification and presumptive TB rate. And in addition to him, let me also welcome Dr. Swayam Prakash Pandey, who is the city TB officer for Junagadh and the district Junagadh and district municipal corporation RCHO. He has been in the program in the service for about 18-19 years and worked in different departments and has been an external monitor for polio immunization project and various activities. And he has also presented papers in international conference and also awarded scholarship for the same. So I'll stop sharing and just bring in, Dr. Ved Prakash. Sir, you do so many things, wear so many hats at the same time. We call you every week for this meeting and we call you for PDSA meetings. The DM calls you for meetings. The CMHO sends you work. CTD sends you work. 5 programs or 4 programs you're looking after. How do you manage your time? How are you able to accomplish all these things? Can you please throw some light? कुछ बताइए कैसे करते हैं आप ये? अकेले तो नहीं कर सकते।
नमस्कार सभी को। तो मैं डॉक्टर वेद प्रकाश। आज के टाइम में जितने भी हेड ऑफ इंस्टीट्यूशन के लिए या सभी संस्थान के लिए सबसे जरूरी है मैनेजमेंट स्किल, क्योंकि नंबर ऑफ प्रोग्राम बहुत ज्यादा है। एक ही किसी पर्टिकुलर को उसका नोडल बना दिया जाता है, तो अपने को सारे को डंप किसी प्रोग्राम को नहीं करना है, सबको इक्वल बराबर लेके जाना है आगे। तो सबसे इम्पोर्टेंट हमारा यही होता है कि इसमें अपने जो सबॉर्डिनेट स्टाफ है उसको अकॉर्डिंग टू स्किल्स, ताकि कम समय में ज्यादा से ज्यादा अपन काम करा के बेटर रिजल्ट लेके आ सकें। तो उसको अपन को सबसे पहले उसको डिवाइड करना है और एक टीम को साथ में बिल्ड करके रखना है, ताकि सब इससे जुड़े रहें, इससे अटैच रहें। और इससे पूरे प्लान को जो भी अपन पूरी टीम मिलके जो प्लान बनाती है उसको इम्प्लीमेंटेशन फील्ड में करवाते हैं फिर, और उनकी ओपिनियन या फीडबैक है वो ग्रास रूट लेवल इवन आशा एएनएम से लेते हैं। अगर आगे फर्दर कोई उसमें सुधार की जरूरत होगी तो अपने एक टीम को साथ में इन्वॉल्व करते हैं, ताकि उस पर भी मेंटली प्रेशर रहे कि सिर्फ अकेले डीटीओ ने नहीं किया, हम सब ने मिलकर के ये बनाया है, तो उनकी प्रॉपर रिस्पॉन्सिबिलिटी डिसाइड रहे। सर
सर कोई एक एग्जांपल शेयर करना चाहेंगे आपने रिसेंटली अगर कोई ऐसी एक्टिविटी में किया हो एक डेलीगेशन और आपका अच्छा रहा हो, सक्सेसफुल रहा हो?
सर पहले से सर एक तो हमने वो कायाकल्प में किया था, कि पहले जैसे मैं और एक दो ऑपरेटर इनको इन्वॉल्व करते थे तो उसे बेटर रिजल्ट नहीं आता था, तो फिर हमने पूरी टीम को बैठा करके सबको अकॉर्डिंग टू जो जितने भी जो उसमें टॉपिक्स थे सबको अलग अलग बांट दिए कि आप इन सब में अपना अच्छे से ऐसा कार्य करें और इसको सुधार करें। फर्स्ट असेसमेंट के बाद में जो गैप रहते हैं वो सेकंड में सुधार करें। तो उससे सर हमारी टीम है वो जिले में टॉप आई, उसे कंटिन्यू हमने 3 बार टॉप किया। सेम यही चीज है कि जब मुझे यहाँ डीटीओ का चार्ज मिला तो हमारे जिले का जो प्रिलिमिनरी एग्जामिनेशन थी वो 367 थी, उसको भी हमने इस तरह से। तो कई बार क्या होता है कि जो अपना स्टाफ है वो कम्युनिकेशन अच्छा कर पाता है नीचे फील्ड से, तो अपन उसको कम्युनिकेशन का ही काम दे। जो ड्राफ्टिंग लेटर की वो अच्छा कर पाता है हम उसको वही काम दे। तो जिससे क्या है कि मतलब काम बहुत ज्यादा है टाइम बहुत कम है, तो वो बेटर रिजल्ट आएगा अपने पास और सारे प्रोग्राम इक्वल रन करेंगे।
बहुत बढ़िया, थैंक यू सो मच। बट सर आपने बोला कि हमें लोगों के स्किल के हिसाब से उनको काम देना है ताकि सही चीज सही रिजल्ट मिले, राइट?
बिल्कुल
बट
सर।
मैं ये जानना चाहूंगा डॉक्टर पांडे कि
Yes, sir.
इसका कोई स्किल भी है करने का, या रैंडमली किसी को दे दिया भाई और तू काम कर दो, डिलीवर कर दो जी, मेरे को ये चाहिए, ये करो और जाओ करके आ जाओ, या कि कोई साइंस है इसके पीछे सर?
Sir, actually, as far as I understand, we should be able to understand each and every individual of our team,
Yes.
their strengths and weaknesses, their field of interest, as well as their attitude. And after summarizing all these things, we can come to the conclusion or just conclusion or definite conclusion how to delegate the work to different individuals in such a way that we would be able to get the best outcome or the best result.
Right. And हम सिर्फ छोड़ देते हैं सर करके कि we keep on, you know, some part in it. DTO also will do some part in it after that.
सर जैसा कि मैं सोचता हूं या जैसा कि मैं प्रैक्टिस में लाता हूं कि मैं खुद भी कई बार फील्ड में जाता हूं।
Okay.
और मैं चाहता हूं कि मैं एज ए आशा वर्कर समझूं उसकी सभी परेशानियों को, वो किस तरह से बेस्ट वे में काम कर सकती है। अगर मुझे बेस्ट आउटकम लेना है अपने आशा वर्कर को, तो मुझे अपने आप को एज ए आशा वर्कर मान करके समझना है कि हम इस काम को किस तरह से कर सकते हैं। उससे हम उसके नजदीक तक पहुंचेंगे, उसके सभी परेशानियों के नजदीक तक पहुंचेंगे, और जिससे एग्जैक्ट एंड एप्रोप्रिएट वे में हम उसे गाइड कर पाएंगे और बेटर रिजल्ट होगा। ऐसा मैं प्रैक्टिकली करता भी हूं
सर ये आपने अच्छे से मेंटरिंग समझा दिया है, सपोर्टिव सुपरविजन समझा दिया, जो एक बहुत इंपॉर्टेंट रोल है एक डीटीओ का अपनी टीम से बेस्ट आउटपुट लेने के लिए।
Yes,
Dr.
sir.
Salil?
Yes, before Dr. Salil comes on, I think we have a question, and that would be good. Commodore Raman, we have a question.
Yeah, Dr. Vivek Srivastav has a question. Mr. Edwin, may I request you to unmute Dr. Srivastav? He has raised his hand. And Dr. Srivastav is DTO Bahadoi. He will put his question. And he wants to share his opinion also.
Sure, absolutely. And then Dr. Salil will hear from you also.
Good evening, everyone. Good evening, everyone.
Good evening.
Yes,
Good evening, everyone.
Yes, Dr.
मैं डॉक्टर विवेक श्रीवास्तव डिस्ट्रिक्ट भदोही से बोल रहा हूँ, यूपी से। मेरा सजेशन ये है, देखिए ये फ्लैगशिप प्रोग्राम है भारत सरकार का, इतना महत्वपूर्ण प्रोग्राम है और इतना जो है इलेबोरेट प्रोग्राम है, भारत सरकार इतना पैसा खर्चा कर रही है, लेकिन स्टेट गवर्नमेंट के लेवल से जो डीटीओ बनाए जा रहे हैं वो स्टेट लेवल से नहीं बनाए जा रहे हैं। उससे एक दिक्कत क्या आ रही है कि जो सीएमओज हैं वो एडिशनल सीएमओ जिनके पास बहुत सारे काम है किसी को भी बना दे रहे हैं, तो डीटीओ फोकस नहीं हो पा रहा है उस कार्यक्रम में, तो वो लीडरशिप नहीं दे पा रहा है क्योंकि वो डेडिकेटेड नहीं है वो एनटीईपी के लिए। तो पहली बात तो ये कि जो लोग ट्रेंड हैं उनको मौका मिलना चाहिए, और ये चीज पॉलिटिकल कमिटमेंट स्टेट लेवल पे होना चाहिए कि हम अगर हमको 2025 तक टीबी फ्री इंडिया बनाना है तो हमें डीटीओ को मजबूत बनाना है। मजबूत कैसे होगा? जब वो सीएमओ की मर्जी पे रहेगा, लोकल लेवल पे उसको चार्ज दिया जा रहा है, स्टेट से अपॉइंट ही नहीं किया जा रहा है डीटीओ, तो वो कमजोर हो जाता है। वो सीएमओ की मर्जी पे हो जाता है कि सीएमओ साहब जितना कहेंगे हमको उतना ही करना है साहब। तो ये चीज देखने की आवश्यकता, ये बहुत बड़ा हर्डल है।
आई टोटली अग्री विथ यू। एंड अगर आप देखेंगे ये प्रोग्राम इसीलिए रखा है कि मल्टीपल चार्जेस हैं, बट अगर हम सीखेंगे कि हम मल्टीपल टीम्स को कैसे यूज करें तो अपनी स्ट्रेंथ को मल्टीप्लाई कर सकते हैं। आई अंडरस्टैंड कि अभी मैन पावर की प्रॉब्लम है ही है, बट उसी मल्टीपल प्रोग्राम्स को यूज करके, सही टूल्स एंड टेक्निक्स यूज करके हम मैनीफोल्ड बढ़ा सकते हैं। एंड आई टोटली अग्री विथ यू सर ऑन दिस aspect, but till that time let's try to focus on getting the best out of the available team.
Sure.
Manoj?
So I think Dr. Mohan, I think Dr. Vivek, thank you for your comment. And what he was referring to is, yes, there has to be prioritization at the state level. State level pe prioritization hona chahiye, and that is agreed, Dr. Srivastava, and we agree on that. So let us go back. Dr. Salil, you had talked about delegation and the importance of that. And let us hear some more details. And yes, we are going to be challenged by having our DTOs having multiple tasks. How do we manage that? How do we deal with that? Dr. Salil and then Dr. Mohan.
Thank you, Manoj. So we have heard from our DTO friends that what should be the style of delegating. In fact, we all have been doing it day to day. But today, Mohan and we will try to tell them the science behind it. If we can do it little scientifically, your outcomes will be better than what you have been doing. तो delegation करते time हमको कुछ छोटी-छोटी चीजों का ध्यान रखना है. Can you move the slides, Mohan? Do you want to show the slides further?
Sir, we'll start with this.
Please.
Make sure your sound is on.
Yes.
Dr. Mohan.
I think his sound is on.
No, I'm not able to hear.
I'm still not. I'm also not able to.
Yeah, Dr. Mohan, why don't you may have to put the sound on.
Sorry.
Yeah.
Give me a second.
Please, आप आराम से करिए. बट जैसा मेरे डीटीओ दोस्त लोगों ने बताया, साहब लोगों ने इन्होंने बताया कि मैं डॉक्टर मनोज वर्मा भोपाल वाले हम सुन रहे थे, उन्होंने बड़ा इंटरेस्टिंग किस्सा सुनाया कि नोटिफिकेशन के लिए कई बार हमारे पास टीम नहीं होती, कि कोई जाना नहीं चाहता अपने डीटीसी से बाहर जाके. मोहन, में 1 मिनट एक किस्सा सुना देता हूँ पूरा. तो डॉक्टर मनोज वर्मा का एक टीबीएचवी थे जो जिनको घूमने का बहुत शौक था. मतलब वो उसको डीटीसी से ज्यादा डीटीसी के बाहर काम करने में मजा आता था. तो उसकी ड्यूटी यही असाइन कर दी कि आप जाइए डॉक्टर से मिलिए, रोज 5 डॉक्टरों से मिलो. तो आप इस तरीके से उनकी कैपेबिलिटीज, उनका इंटरेस्ट, उनका किस चीज में उनको मजा आ रहा है, वो चीजें पकड़ के, और आपकी जो प्रॉब्लम है, इनफैक्ट उनकी ये प्रॉब्लम रहती है कि बाहर जाके कोई काम नहीं करना चाहता, और उनको एक आदमी तैयार है जो बाहर जाके काम करना चाह रहा है. डॉक्टर मनोज वर्मा यदि होंगे तो मेरी बात सुन रहे होंगे. उन्होंने मेरे को बहुत सारी इसमें की अच्छी बातें हमारे डीटीओ साहब लोग बताते हैं. एवरीबॉडी हैज इट्स ओन आइडियाज. तो इसमें के तरीके ढूंढ के हमें अपनी टीम की जो कैपेबिलिटीज या जो उनकी स्ट्रेंथ है उसको काम में लेना चाहिए अपनी परेशानियों को सॉल्व करने. या मामूल, प्लीज.
Delegation is the assignment of any authority to another person to carry out specific activities, and it's one of the core concepts of management leadership. One thing to note is that the person who delegated the work remains accountable for the outcome of the task. Let's say that you have to write the article, and because you also have to do some other tasks, you decide that you'll delegate article writing. If the person screws up and delivers poor quality of work, then you'll be still held accountable for it.
Great.
Accountability is really important.
Still remains with me, even if I have delegated the work.
Perfect.
So I cannot say I given the work, it is his work.
Delegation is the assignment.
Okay.
So this is one reason actually people don't delegate. Delegation is an art. It takes time usually to delegate, Manoj, initially. But once you learn that art and you get to know your team, you can create copies of yourself in a way, and you can multiply the work. It is hard to do. It takes time. And we have a sense in ourselves. I can do it best and nobody else can do it as good as me. Unless we teach them, they will never be able to do it. It is like a surgeon, learning to do surgery, right? Unless he starts doing it small pieces, he will never be able to do the bigger surgery. So that is how you delegate small tasks and increase their confidence to do the bigger things. Right, Dr. Salil?
बिल्कुल, मैं आपकी बात से सहमत हूँ और इस तरीके से ही हमको देखना पड़ेगा कि आपके मन में जो डर है, मैं दे नहीं सकता, ये कर नहीं सकता, वो कर नहीं पाएगा, ही इज नॉट कैपेबल टू डू इट, प्लीज इसको निकाल दीजिए। आपके पास बहुत सारे अच्छे अच्छे लोग हैं जो बहुत छोटे छोटे से काम या बड़े बड़े काम सब कर सकते हैं। और लेट अस सी व्हाट, हु, हाउ टू डेलीगेट। मोहन
Very
बताइए।
important. We cannot delegate everything, right?
Sure.
We need to also understand what work to delegate. It has been told very well by Dr. Ved Prakash ki kya delegate, kisko delegate karna, how, right? But now, before I say what is to be, how to delegate, remember three small simple things. What I need to do now, I do this, right? What is the thing which only I can do, I cannot give to anybody? For example, probably confidential things, probably some financial things, I would like to do it myself, right? But other things which can be delegated should be given again for the other people to do.
Usually, the easiest tasks to delegate are repetitive, simple to learn, and time-consuming tasks, as they will give you more time to focus on what really matters. A very common mistake when it comes to delegation is that people expect miracles from it, and then they complain that delegation doesn't work. To avoid it, you have to be ready to put a little bit of a work from your side, and then delegation will become easy and deliver results. Define the outcome that you want to achieve and provide the person with the sufficient training and resources. Make sure that you monitor the process, at least at the beginning, so that you know that the things are moving in the right direction.
Great. So what do you understand? Overall, if you see, delegation is an art. Done correctly, give you good results. Not done correctly, will give you heartache and pain, and you have to redo the work probably, right? So tell them what to do, give them the training and resources, keep on monitoring for some time until you are confident in how they will deliver the work. Yes, sir, Dr. Pandey?
Yeah, yes, you can unmute Dr. Prakash and Dr. Pandey and your thoughts and comments on this, please.
Edwin, can you unmute Dr. Prakash and Dr. Pandey? Edwin?
Yes, I already unmuted.
सर आपको अनम्यूट करना पड़ेगा सर,
आपके एंड से अनम्यूट करिए।
डॉक्टर प्रकाश, डॉक्टर वेद प्रकाश, आपको भी अनम्यूट करना पड़ेगा सर अगर बोलना है तो।
हाँ, यदि आप कुछ बोलना चाहते हैं।
Yes. Yeah, go ahead, Dr. Pandey.
Yes, sir.
सर आप कुछ शेयर करना चाह रहे हैं?
डेलीगेशन के बारे में आपके क्या विचार हैं? आप कोई बताना चाहते हैं? आपको लगा कुछ इसमें से कुछ और बात? जी
सर, अगर एप्रोप्रिएट डेलीगेशन ऑफ वर्क होगा और जैसे सर्जरी में टीम वर्क होती है, ऐसे ही हमारे यहाँ भी एक टीम वर्क होगी और एक सर्जन, कितने भी बड़े सर्जन हो, सब कुछ नहीं कर सकते, उनको असिस्टेंट की जरूरत होती ही है। सिमिलरली अगर डीटीओ यह सोचे कि हम सब काम कर लेंगे तो दैट इज नॉट पॉसिबल। ही हैज टू चूज द बेस्ट पर्सन टू whom he can delegate the responsibilities concerned, who can do it in the best way.
Excellent, excellent. आपको याद होगा अपन ने जब पहली बार पहला सेशन लिया था और मैंने मेरी फेवरेट बॉलीवुड मूवी के बारे में बातें करा था, and it is about भुवन and it is the movie लगान। आप देखो भुवन ने किस तरह से एक टीम मेंबर को डिफरेंट टास्क डेलीगेट करके उसकी एडवांटेज, उनकी स्ट्रेंथ्स देखी। So as we conclude today, what I'm hearing is, look, be like Bhuvan. All of the DTOs, you are the Bhuvan for your district, for your program, right? Number one, take leadership. Bhuvan took leadership. Number two, situational analysis. आप अपनी situation देखिए. You look at what your strengths and weaknesses are. You see the situation that is at hand. अपनी situation क्या है? We have to deal with a post-pandemic decline in notifications. We know that our program needs to be boosted. Dr. Srivastav ने बहुत अच्छा point बताया. Look, priorities थोड़ी mixed up है at the state and the central level. And I agree with you, Dr. Srivastav, 100% as other DTOs are there. Within our resources, we need to continue this. So taking leadership. Number two is situational analysis. And the third is we cannot do it alone. Apan akele ye sab kaam nahi kar sakte. We need to be delegating. And again, don't expect miracles, but make sure that you're able to delegate repetitive tasks, things that you can manage, yet you don't have to do them yourself. So that is the key lessons from today's conversations. We have talked about what will make success BTN, boosting TB notifications successful, what will make you as a successful DTO, what will help you win the award for the subnational. That is what we want to be able to do in every way. आपके पास जैसे डॉक्टर मनोज वर्मा ने बोला, अपने पास टेक्निकल स्किल्स हैं, अपन को अडेप्टिव स्किल्स, मैनेजमेंट जिसमें आता है, adaptive skills we have to get. So great conversation, Dr. Mohan, Dr. Ved Prakash, Dr. Pandey, and all of our DTOs and Dr. Salil. Now, I would like to ask if any other comments, and then we start our very unique and interesting session as well in breakout rooms. But before, and we'll ask Commodore Raman to come in and prepare us for that. But Dr. Mohan, from your end, other ideas and concepts that you want to share?
Yeah, only one thing. Use these skills. It takes time to perfect for a particular, maybe 2 or 3 times, but once you do it, it will save you time. These are actually man management and time management tools. You will get a lot of free time to do the things you want to do. If you build your team, and that will be covered by Commodore Raman in a few sessions, team building. Sir, over to you.
Thank you, Dr. Manoj, Dr. Mohan. Wonderful session, great session. And Mr. Edwin, are we ready technically to get into the breakout rooms? May I request you to just give brief instructions to all the DTOs? What are they to expect? And then let us move into the breakout rooms.
Okay. Thank you, Commodore Raman, sir. I just want to take few minutes here just to give you instruction. I hope everybody have read through the instruction, but I'll just repeat it quickly. So in case your name is not renamed or prefixed with the room number assigned to you, just do it if you can as soon as possible. Once the breakout room is open, तो आप लोगों को अपने आप pull in किया जाएगा. In case you remain outside, your counselor or I will help you get in. And the breakout session will last for 20-25 minutes. Raman sir, how long we're taking now?
We will continue now, and breakout room will close at 5:53.
Okay, and after that we'll have 5 to 7 minutes to review.
Yeah. So, and you can also tell them that there'll be a 2 minutes warning notice for the counselors to wind up.
Yes, so everybody will be able to see a countdown on top of their screen. So we'll also send you a timer when it is going to be closed down.
एडविन, मैं शायद ये समझ रहा हूँ कि जैसे हम लोग एक बड़े हॉल से कॉन्फ्रेंस में छोटे-छोटे कमरों में जाके छोटे-छोटे ग्रुप्स में बात करते हैं, ऐसा कुछ आप डिजिटल ब्रेकआउट रूम्स बना रहे हैं, इज दैट राइट?
हाँ जी, जो पूरे ग्रुप हैं अभी आप जो देख रहे हैं, इतने सारे DTOs हैं, अभी 250 प्लस DTOs अभी अवेलेबल है. तो उन लोगों को हम अभी 30 ग्रुप्स में डिवाइड कर रहे हैं. और हर एक ग्रुप में 8 to 10 DTOs वहाँ अवेलेबल रहेंगे और वहाँ पर हर एक रूम में 2 काउंसलर्स अवेलेबल हैं to help them out.
Great. And this is really an opportunity just to tell all the DTOs कि अपन क्या करेंगे. तो अपन क्या करेंगे कि it's an opportunity in a breakout room to share. So first introductions, and then you will share what is your aim statement. So now we will begin to share some of the work that you have been doing. जो आप PDSA का काम कर रहे हैं, let us work to look at and share with our other DTOs what our aim statement is, what your measures are, as well as what are your team members. And if you have it, that's great. If you don't, that is no problem. You will share your challenges as well on those matters. And then we will look at individual data from a particular, your districts. Each one of your districts has that notification curve that has been developed as well, private, public, and total. And then you will share that conversation of why it has gone up and down and what we are doing to boost it. And then we will come back and we will hear from you DTOs as you begin to share your experiences in the larger group again. And we'll ask some of you to share your experiences. So Edwin, if all is set, then we're ready to go into our breakout rooms.
Yeah, I'm moving the breakout room right away. Thank you.
Okay, great. Commodore Raman, other instructions for our DTOs as they go into our breakout rooms?
No, Dr. Manoj, we have covered everything. You have covered the what is going to happen, and Edwin has covered otherwise. They have been briefed also by the counselors. We're good to go.
Great. And you can see that the numbers are reducing as the everyone is going into a breakout room, and our counselors are going to be there to greet you and to begin the process as well of engaging, and then we will come back as well. So great to have everyone there, and we'll have all the counselors need to also move out into the breakout rooms if they haven't already done so. So counselors, please also move out into the breakout rooms and greet your DTOs, begin with introductions, and then we'll go from there. Spend about 25 minutes, and then we will regroup. So let us begin our conversation with that. Excellent. I see almost 200 or plus have already been assigned in breakout rooms, and I see people are in breakout rooms and they'll be there. So very good. A good number are there. So, and I'll ask all our counselors to also head into the breakout rooms, and those DTOs who have not been in a breakout room, let us just be patient. You will be in there. Faculty will be moving from room to room as well. Dr. Salil, Commodore Raman, Dr. Mohan, and others, you will see us come in briefly in the breakout rooms as well. Also, the staff as well, Dr. Amish, Sangeeta, Pooja will be also be in the breakout rooms as we move ahead. Nearly everyone is being assigned, and the conversations are beginning in the breakout rooms as we so breakout rooms should be closing. Welcome DTOs, welcome counselors, excellent conversation. Welcome. I had a pleasure of being in multiple conversations with multiple DTOs and real insight, real good conversation. Commodore Raman, I know you were in there. Let's recap in the next 5 minutes. This was a pilot. This was a start of something really unique, unique way of us engaging and conversing. So Commodore Raman, over to you in having our discussions and hearing from some of the insights from our DTOs as well.
Yes, thanks, Dr. Manoj, and definitely very insightful. And DTOs today was the actual beginning of the professional interactions, that you will have, and these breakout sessions will be a norm now. And this is how we'll be doing it henceforth. So may I request Dr. Sejal to present the graph that was being shown in the room of DTO Munshi, Dr. Munshi, Jamtara.
Yes, sir. I have shared the PDF.
Yeah, please share the screen. And Dr. Manoj, may I request you to do the analysis of that graph and lead the discussion on that?
Sure. And these are the conversations that were going on in the room that we were all in. So several conversations that were happening on the graph were first, before we get to that, aim statement. All of you were very much in tune that there was something that had to be done, and you were developing aim statement. तो अपन देख सकते हैं that ये aim statement was being made in Jamtara. We will increase notification by 5% within 2 months, maintaining records. So this is the intervention: records of patients referred by ASHA, IEC conducted during home visits, by STS, fast tracking cards of suspected TB patients. Like this, we are going to have over 300 to 400 the PDSAs developed. Commodore Raman, your thoughts as we hear from each of the DTOs over time and on their aim statement.
Well, to be precise, Dr. Manoj, I was witnessing this PDSA presentation, and the SMART aim statement that we talk about is very clearly reflected here. The thought process and the decision of the DTO is on screen, and that of the entire team. Now we will not deviate from the path. This is our objective, that 5% increase in notification in 2 months. This is the objective of the DTO, the district, and the team. Sejal, would it be possible for you to showcase the graph of the district also?
Excellent. And yes, in my visits to the various rooms, I had a chance to listen to Dr. Chobisa, excellent work, Dr. Yasmin, excellent work, Dr. Anand, excellent work. So many people doing really, really good work, developing that aim statement, and then also looking at their graph and seeing how notifications increasing. One of the topics that we discussed was, could the pandemic with people masking have an impact on our notifications not increasing to other levels? This has been a conversation in academic circles. As far as we have seen, that there were rather more missing cases. That was one of the major reasons for the decline. And yes, we may see that there might not be a very large number of pool of cases that might be there because people were masking, but certainly we saw a decline. So let us finish up, Commodore Raman. We've reaching
it is
our final hour.
Yeah.
And we will finish up with the following comments. In the first part, you've talked about the what will take us to boost notification and the skill sets that are critically important: leadership, analysis, being analytical, and delegation. And in the second set, we talked about our aim statement, and now the graph. As you can see, in our district in Jamtara, at baseline, there were 150 to 100 or so at baseline. Pandemic saw a decline. There was recovery, and now back to close to baseline, and then subsequent boosting will be there, that will be happening. Each one of you has this graph for your district. Look at it very closely. And once your boosting numbers are achieved at baseline or beyond, what is going to happen subsequently? We see this in every single country, in every part of the world. Precipitously 5 to 10% decline in notifications or in actual TB incidents over years. That what happens once you reach the peak of your incidence rate, and then comes the decline. Why? Because you are not seeing any more cases that are transmitting, that are missing. You are picking them up. You pick them up early, transmission drops at 5 to 10%. So I will finish up with that. I know there's lots of questions and queries. We have another 4+ sessions to go, and your individual meetings with the counselors. So Commodore Raman, what is to expect? What are our DTOs to expect over the next several weeks? Let's inform them, and let's look forward to our meeting next week.
Thank you, Dr. Manoj. DTOs, the learning part is over, in which we had to learn how to do the PDSA. We have launched the PDSA. Now, each week, our meeting will be only to assess, analyze, and iron out any difficulties that you may be facing. That is going to be the objective. And this will happen during the weekly meetings also. We have the baseline in front of you in form of a graph. This is the baseline for you. And we have to all beat the 2019 notification. That is our collective target in all the districts. The graphs are self-explanatory. It gives an indication where the effort has to be put in. So each week we will come up with some interesting topics to keep the session engaging on leadership, on management, on team building. And at the same time, we'll go into breakout rooms and we'll see the progress that we are making as far as PDSA is concerned. With this, Dr. Jain, I think we have taken 3 minutes extra. It is time for us to close. We start the sessions in time, and I want all the counselors, please communicate to your DTOs that we always close, open the session and close the session in time. With this, thanks to CTD, thank you DTOs, thank you team leads and counselors for a wonderful, great session. Thank you the 6 guest faculty that joined us today. Thank you so much. You made it hugely, hugely interesting. And if Dr. Manoj, Dr. Salil, you have anything last words, otherwise we can just close.
Great. That's all we have. Namaste. Take care. We will see you next week.
Good night.
Good night.